Welcome to our channel where we explore health topics that truly matter to your everyday life. Today, we're going to dive deep into an issue that affects millions of people around the world but often goes unnoticed until it causes serious problems: uric acid. Whether you've heard about it from your doctor, a family member, or you've seen it mentioned online, this topic is essential to understand, especially if you want to take control of your health and prevent painful conditions like gout or kidney stones. So, let's uncover what uric acid is, why it rises, what signs to look out for, and how you can manage or even reduce it naturally and effectively. Uric acid is a waste product that forms when the body breaks down substances called purines. These purines are found naturally in your body but also come from the food you eat. When you eat foods that are rich in purines like red meat, organ meats, seafood, and alcoholic drinks, especially beer, your body produces more uric acid. Normally, your kidneys filter uric acid and expel it through your urine. However, if your body produces too much uric acid or your kidneys don't remove enough of it, it builds up in the bloodstream. This condition is called hyperuricemia. At first, you may not even notice when your uric acid levels are high. But over time, if left uncontrolled, it can lead to the formation of uric acid crystals. These crystals tend to deposit in the joints, especially in the big toe, ankles, and knees, causing inflammation and a painful condition known as gout. It can also lead to kidney stones or, in chronic cases, even kidney damage. So, while it might seem like a small issue, elevated uric acid is something that needs serious attention. Now, how do you know if your uric acid levels are high? The symptoms can be subtle at first. Some people experience joint pain, usually sudden and intense, often waking them up at night. The affected joint may become red, swollen, and tender to the touch. You might feel like even a bedsheet brushing against it is too painful. This is one of the classic signs of a gout attack. If the condition becomes chronic, these attacks may become more frequent and affect more joints. You may also feel fatigue, difficulty moving the joint, and in some cases, notice small lumps under the skin called tophi, which are deposits of uric acid crystals. But it's not just joint issues that should concern you. High uric acid levels can also impact your kidneys. One of the major consequences of excess uric acid is kidney stones. These stones form when the uric acid crystallizes in the kidneys. They are not only extremely painful to pass but can also lead to infections or kidney damage if not treated. Some researchers even link prolonged high uric acid to hypertension, heart disease, and metabolic syndrome. So, what causes uric acid to go up in the first place? Apart from purine-rich foods, there are several contributing factors. One of the major culprits is diet. Consuming large amounts of red meat, seafood, sugary drinks, and alcohol significantly increases the production of uric acid. Especially fructose, the sugar found in sodas and processed foods, has a strong link to higher uric acid levels. Genetics also play a role. If someone in your family has gout or high uric acid, you're more likely to develop it. Obesity is another major factor. The more body mass you have, the more uric acid your body tends to produce. Being overweight also affects how efficiently your kidneys can process and remove uric acid. Certain medical conditions, such as diabetes, hypothyroidism, kidney disease, and even psoriasis, can contribute to elevated uric acid levels. Medications like diuretics, which are commonly prescribed for high blood pressure, can also interfere with how the body gets rid of uric acid. Dehydration is another often overlooked cause. When you don't drink enough water, your urine becomes more concentrated, making it easier for uric acid crystals to form. Now that we understand the causes and symptoms, the big question is, how can you manage or reduce uric acid levels naturally? The good news is, in many cases, you can bring uric acid levels down with lifestyle changes, especially if the condition hasn't progressed too far. First and foremost, your diet is your greatest tool. Start by reducing the intake of purine-rich foods. Limit or avoid red meat, organ meats like liver, anchovies, sardines, shellfish, and alcohol, particularly beer. Instead, opt for lean proteins like chicken, eggs, and plant-based sources such as lentils and beans, though some legumes may have moderate purine levels. Low-fat dairy products can be beneficial too, as studies show they may help lower uric acid levels. Drink plenty of water throughout the day. Staying well hydrated helps flush uric acid from your body. Aim for at least 8 to 10 glasses of water daily, and more if you are physically active or live in a hot climate. You can also include herbal teas and infused waters to keep things interesting. Avoid sugary drinks and sodas as much as possible, especially those sweetened with high fructose corn syrup. One of the best natural remedies for high uric acid is consuming cherries. Cherries, especially tart cherries, have been shown to lower uric acid levels and reduce inflammation. Other helpful fruits include berries, apples, oranges, and citrus fruits rich in vitamin C, which helps reduce uric acid. Whole grains, nuts, seeds, and plenty of vegetables should form the core of your meals. Leafy greens, carrots, cucumber, and tomatoes are excellent choices. Weight management plays a significant role. If you're overweight, losing weight gradually can help reduce uric acid levels and decrease your risk of gout attacks. However, avoid crash diets or fasting, as they can have the opposite effect and increase uric acid production. Exercise regularly, even 30 minutes of walking, stretching, or light cardio can make a big difference. It's also worth looking at your stress levels. Chronic stress impacts hormone balance, digestion, and inflammation, all of which can influence uric acid levels. Try incorporating stress management techniques like deep breathing, meditation, yoga, or even just taking time out to relax with a good book or music. Sleep is another important factor. Lack of sleep can lead to poor metabolic function, making it harder for your body to maintain healthy uric acid levels. In more severe or persistent cases, medical treatment may be necessary. Doctors may prescribe medications such as allopurinol or febuxostat to reduce uric acid production, or probenecid to help your body excrete it more efficiently. But even if you're on medication, lifestyle and dietary changes remain essential for long-term management. Always talk to your healthcare provider before starting any treatment or supplement. Speaking of supplements, some natural remedies might help support healthy uric acid levels. For example, vitamin C supplements have been shown to reduce uric acid, though it's best to get your nutrients from food first. Omega-3 fatty acids, found in fish oil or flax seeds, can help reduce inflammation. Turmeric and ginger are also known for their anti-inflammatory effects. Baking soda is sometimes mentioned as a home remedy, but it should only be used under medical guidance, as excessive use can be harmful. Remember, everyone's body is different. What works for one person might not work for another. The key is to be consistent, monitor your symptoms, and get your uric acid levels tested regularly. Prevention is always better than cure. By making small but powerful changes in your lifestyle, you can take control of your health and avoid the complications that come with high uric acid. If you suspect you have symptoms related to high uric acid or gout, don't ignore them. Early intervention can prevent long-term damage. And if you're already managing high uric acid, know that you are not alone and that it is possible to lead a healthy, active life with the right choices and mindset. Thank you so much for watching today's video. If you found this content helpful, don't forget to like this video, subscribe to our channel, and hit the bell icon so you never miss an update. Also, we'd love to hear from you in the comments. Have you dealt with uric acid issues before? What lifestyle changes worked for you? Let's build a community of support and learning together. Until next time, stay healthy, stay hydrated, and take care of your body, it's the only one you've got.